rhomboid minor. Origin, nuchal ligament, insertion, medial end of the movement, retracts, downwardly rotates, and stabilizes the scapula.
The biceps brachii is a prominent arm muscle. It originates from 2 points on the scapula, inserts on the radius and bicipital aponeurosis. It flexes the elbow and supinates the forearm.
The abductor digiti minimi. It arises from the pisiform bone. Inserting into the proximal phalanx, it abducts the little finger.
The abductor pollicis brevis. It originates from the scaphoid and trapezium. It inserts on the proximal phalanx. This muscle abducts the thumb.
Rhomboid major. To T5 spinous processes. Medial border of the scapula. Movement, retracts, downwardly rotates, and stabilizes the scapula.
Origin, nuchal ligament T1 spinous processes. Insert medial end of the scapular spine. Movement, retracts, downwardly rotates, and stabilizes the scapula. Rhomboid major. Origin, T2 to T5 spinous processes. Medial border of the scapula. Movement, retracts, downwardly rotates, and stabilizes the scapula.
Quadratus. Origin, distal anterior ulna, distal anterior radius. Movement, pronates the forearm and stabilizes the distal radio-ulnar joint.
Pronator teres. Origin, medial epicondyle and coronoid process. Insertion, middle lateral radius. Movement, pronates the forearm and assists elbow flexion. Pectoralis minor. Origin, ribs 3 to 5. Insertion, coracoid process. Movement, protracts, depresses, and downwardly rotates the scapula.
Palmaris longus. Origin, medial epicondyle of the humerus. Flexor retinaculum and palmar. Movement, flexes the wrist and tenses the palmar fascia.
The pectoralis major is a thick, fan-shaped muscle. It originates from the clavicle, sternum, and costal cartilages, inserting into the humerus. It flexes, adducts, and medially rotates the arm. Palmaris brevis. Origin, palmar aponeurosis and flexor retinaculum. Insertion, skin of the ulnar palm. Movement, wrinkles the skin of the palm and deepens the hollow of the hand.
Levator scapulae. Origin, transverse pros C1 to C4. Insertion, superior medial border of the scapula. Movement, elevates and downwardly rotates the scapula.
Opponens pollicis. Origin, flexor retinaculum and trapezium. Insertion, first metacarpal. Movement, opposes the thumb.
Palmar interossi. Origin, 2nd, 4th, and 5th metacarpals. Insertion, proximal phalange and extensor expansions. Movement, adduct the fingers.
Latissimus dorsi. Origin, lower spine, iliac crest, and ribs. Insertion, humerus. Movement, extends, adducts, and medially rotates the arm.
Flexor pollicis brevis. Origin, carpal bones and flexor retinaculum. Insertion, proximal phalanx of the thumb. Movement, flexes the thumb.
Infraspinatus. Origin, infraspinous fossa of scapula. Insertion, greater tubercle of humerus. Movement, laterally rotates and stabilizes the shoulder.
Palmar interossi. Origin, palmar metacarpals. Insertion, proximal phalanges and extensor expansions. Movement, adduct the fingers.
Flexor carpi radialis. Origin, medial epicondyle. Insertion, 2nd and 3rd metacarpals. Movement, flexes and abducts the wrist. Flexor digiti minimi brevis. Origin, hamate and flexor retinaculum. Insertion, proximal phalanx of the little finger. Movement, flexes the little finger.
Flexor digitorum superficialis. Origin, humerus, ulna, radius. Insertion, middle phalange of digits 2 to 5. Movement, flexes fingers and wrist. Extensor carpi ulnaris. Origin, lateral epicondyle and ulna. Insertion, 5th metacarpal. Movement, wrist extension and ulnar deviation.
Flexor digitorum. Origin, lateral epicondyle. Insertion, extensor expansions of digits 2 to 5. Movement, extends fingers and wrist.
Extensor pollicis longus. Origin, posterior ulna and interosseous membrane. Insertion, distal phalanx of the thumb. Movement, extends the thumb.
Extensor carpi radialis brevis. Origin, lateral epicondyle. Insertion, 3rd metacarpal. Movement, wrist extension, and radial deviation.
Extensor carpi radialis longus. Origin, lateral supracondylar ridge. Insertion, 2nd metacarpal. Movement, wrist extension and radial deviation.
Dorsal interossi. Origin, adjacent metacarpals. Insertion, proximal phalanges. Movement, finger abduction. Deltoid. Origin, lateral clavicle, acromion scapular spine. Insertion, deltoid tuberosity. Movement, shoulder abduction. Subscapularis. Origin, subscapular fossa. Insertion, lesser tubercle of the humerus. Movement, medially rotates, adducts, and stabilizes the arm. Supinator. Origin, lateral epicondyle, ligaments, and ulna. Insertion, proximal lateral radius. Movement, supinates the forearm. Origin. Televin to L2 spinous process. Insertion, ribs 9 to 12. Movement, depresses the lower ribs during forced expiration. Subclavius. Origin, first rib and costal cartilage. Insertion, inferior surface of the clavicle. Movement, depresses and stabilizes the clavicle.
Inferior. Origin. T11 to spinous process. Insertion, ribs 9 to 12. Movement, depresses the lower ribs during forced expiration.
Serratus anterior. Origin, ribs 1 to 8. Insertion, anterior medial border of the scapula. Movement, protracts, upwardly rotates, and stabilizes the scapula.
Serratus posterior superior. Nuchal ligament and C7 to 3 spinous processes. Insertion, ribs 2 to 5. Movement, elevates the upper ribs during inspiration.
Origin, nuchal ligament and C7 to T3 spinous processes. Insertion, ribs 2 to 5. Movement, elevates the upper ribs during inspiration.
Teres minor. Origin, lateral scapula. Insertion, greater tubercle of humerus. Movement, externally rotates and stabilizes the shoulder.
Teres major. Origin, inferior angle of scapula. Insertion, medial humerus. Movement, extends, adducts, and medially rotates the arm.
Supraspinatus. Origin, supraspinous fossa. Insertion, greater tubercle. Movement, initiates shoulder abduction.
Trapezius. Origin, occiput, nuchal ligament. Insertion, clavicle, acromion, scapular spine. Movement, elevates, retracts, and rotates the scapula.
Trapezius. Origin, C7T12. Insertion, clavicle, acromion, scapular spine. Movement, elevates, retracts, and rotates the scapula.
Teres minor. Origin, lateral scapula. Insertion, greater tubercle of humerus. Movement, externally rotates and stabilizes the shoulder.
Triceps brachii. Origin, scapula and posterior humerus. Insertion, olecranon of ulna. Movement, extends the forearm and assists shoulder extension.
Teres minor. Origin, lateral border of scapula. Insertion, greater tubercle of humerus. Movement, externally rotates and stabilizes the shoulder.
Triceps brachii. Origin, scapula and posterior humerus. Insertion, olecranon of ulna. Movement, extends the forearm and assists shoulder extension.